Dr. Sajid here. We're going to continue with our discussion of problems of the ear, nose, throat in children, and we will cover the nose and the throat today. The nose is somewhat flat in newborns, as I have mentioned earlier, and that is normal. And over the next few months, towards the end of the first year, during the second year, it becomes what is called normal. Which means the bone has taken shape and it's not as flat, and this is normal. Now, at the time of birth, one of the things that is checked is what we call the patency of the nostrils, which means that there can be occasionally a problem on one side of the passage from the nostril. And if that happens, then the baby can have breathing difficulties. This is very rare, but it is checked. If the baby has breathing difficulties in the first few weeks of life, this must be checked. Most problems in infancy and childhood pertaining to the nose have to do with either viruses or allergies. Infections are generally, bacterial infections are generally very rare, so most infections are either viral or problems of allergies. Now, many times it's difficult to distinguish between a virus and an allergy, but if child has a watery nose, it's a clear discharge, the eyes may be watery, and the child is sneezing, then it becomes a little easier to diagnose allergies. And the treating pediatrician can also look at the lining of the nose and decide whether this is allergic or not. The viral infections are very common. That is the common cold, and in that also you get a runny nose, although you also get some fever and may also get a little bit of a cough. So the treatment will depend on what the initial cause is. If it is allergy, then anti-allergies are given. If it is a cold, sometimes a decongestant is given. Occasionally nose drops are given, especially to the older children. Humidity is advised, and avoidance of allergies if there is an allergy. And if the child is prone to a lot of viral infections, it is recommended that flu shot be given. The second common problem generally that we see in infants, and especially infants and young children, is that they will sometimes get what we call parts of toys or beads or whatever into the nose, and then the nose can start smelling bad, and it is usually on one side, and your doctor can easily detect it, and you should not try to remove this and let the doctor take care of it. The other problem that causes a lot of difficulty in children is what we call adenoids. Now, these are like lymphatic tissue that sits in the back of the nose, and what that does is that it causes the child not to be able to breathe from the nose, and therefore the child keeps the mouth open, especially at night. And these are the children who sometimes the parents complain will snore at night, and they will have frequent colds and will have frequent ear infections. And so adenoids, if they are causing a lot of problems, especially in the child older than 3 years, that can be surgically removed. Otherwise, we don't recommend surgical removal unless very severe, and some decongestants or anti-allergy medicines can be prescribed. Now, coming to the throat, that is a big problem, because everybody, anytime they start to see a child with any cough or any fever, it is diagnosed as so-called tonsillitis by either the family or the relatives, or sometimes even the doctors. Now, most infections of the throat are viral. The so-called tonsillitis that you talk about is bacterial, and in that there is a distinct bacterial infection, and that happens in school age years. The child has high fever, may have headache, may have sore throat, may have difficulty swallowing, And generally there are glands also on the sides of the throat. But remember, there is no cough. In what we call bacterial tonsillitis, there is no cough, and that is a distinguishing sign. Maybe a little scratchy throat, but no cough. And if this tonsillitis is diagnosed repeatedly, occurs maybe 5 or 6 times in a year, it requires a lot of antibiotics, and makes the child miss school, and the child's growth may be affected, then of course only then is surgery recommended. Otherwise, antibiotics given by mouth are a very good remedy. So tonsillitis, remember, you need to make a proper diagnosis to be able to give antibiotics. I hope you have been able to get some sense of problems of the nose and throat. We shall continue.